explosive. We should all be lifelong learners, right? So once you're in, um, you always should be looking at ways to develop yourself. I like fun. The hammocks are always full, so I can't ever lay in a hammock. I love seeing students light up. Oh gosh.
Hello, everyone, and welcome to the HIAC One-on-One Podcast, brought to you by the Health Informatics and Analytics Club at the University of North Florida. I'm Agrani, your host for today's conversation. In this series, we sit down with thought leaders and professionals shaping the future of health informatics. One guest, one story, one deep dive at a time. Today, we are honored to have with us Professor Kay Thiemann, the founder of the Health Informatics program here at UNF. Our faculty advisor and a dedicated mentor whose vision has laid the foundation for preparing future leaders in this field. Professor Thiemann, thank you so much for joining us today.
Oh, you're welcome, Agrani. It is certainly a pleasure to be here. Thank you.
Before we dive in, I did like to start on a lighter note. Can we begin with a quick icebreaker?
Sure.
Okay. Coffee or tea?
No, coffee for sure.
Okay. Awesome. I too prefer it to kickstart my day. And I
Yep.
think most of us can relate.
Yep, for sure.
Yeah. So without further ado, let's brew some interesting and flavorful conversation for our audience today.
Great.
As the founder of the Health Informatics program at UNF, what inspired you to establish it? And what was the pivotal moment that confirmed this was the right direction for both the university and its students?
Great. Well, that's a great question, Agrani. So, I'm fairly new to the University of North Florida. I came to UNF here in Jacksonville, Florida in January of 2022. Prior to that, I was a healthcare administrator for a very large health system. And I was also, for the last 4 years of my career, I was a system-wide or enterprise clinical systems administrator. And in that role, I saw firsthand the impact of the electronic health record, all sorts of technology applications that impact patient care every day. And I saw more and more over the years how our providers and clinicians need to use technology to inform and deliver patient care. So that was kind of the impetus that inspired me when I got to UNF. So I want to mention first to the audience what is health informatics because it's pretty broad. And for purposes of our discussion today, I'd like to define it as the ability to turn healthcare information into information and knowledge. So think about all the technology. When you go to the doctor's office, or let's say you're in the hospital, or a family member is in the hospital, and you see all this technology around you, all these computers and all of these machines collecting data and delivering care. Well, all of that data is being retrieved and stored somewhere and perhaps eventually studied to inform decision making for our clinician and inform better health care. And I saw that on a regular basis at the health system where I worked, which happened to be Mayo Clinic. And I saw the ability of that information to really improve patient care. So I had that background when I started at the University of North Florida. I arrive at the University of North Florida, and the first day on the job, I have lunch with my department chair, who at the time was Dr. May Zhao, who is now the Dean of the Brooks College of Health at the University of North Florida. And I'm having lunch with Dr. Zhao and two other faculty members, and she said, gosh, we really need to start a health informatics program at the University of North Florida. We really want to offer our students the ability to not only go into healthcare management, and we had programs at the bachelor's and master's level at the time for healthcare administration, but we really want to offer students who want to get into technology and data. We want to offer them an opportunity. And I said, well, that's interesting because I spent the last few years at my health system overseeing the Epic optimization. We had just put Epic healthcare record into our organization, had just implemented it across the entire health system. And I moved into the system-wide administrator role to optimize the electronic health record at the time. And so again, I saw firsthand the impact of technology at the bedside. So I saw that, plus I was having a conversation with my new boss, and that literally was the impetus for starting the health informatics program. So the vision and the pivotal moment for me, I guess, was the confluence of my background along with the need that was identified at the university. That all came together literally on the first day on the job. I also had program development experience and a background in that, given my 30 plus years in the healthcare industry. And so I was able to help develop the program application. One of my predecessors, who is Dr. Cynthia White-Williams. I want to give a shout out to Dr. White-Williams, who is now at the University of Central Florida. She did a lot of the legwork, some background and research on the program, and I was able to utilize some of her information and complete an application that went to the state university system to develop the program. I do want to point out that our program is a bit unique. Our program is unique because number one, it was developed in consultation with industry leaders. So with my connections in the industry, people working bedside in delivering care every single day, they actually sat down with me and told me the skill sets that are needed for our health informaticists working in the clinical space. So that is one feature of our program that makes us unique. The second feature is that it is delivered in collaboration with three colleges at the University of North Florida. So the program resides in the Brooks College of Health because it's related to healthcare, but the delivery of the program and the courses offered are not only offered from the Brooks College of Health, but from our School of Computing at the University of North Florida and our College of Business. So we have three colleges or schools coming together at UNF, working collaboratively to deliver this program. And if you think about it, that is really optimal because it is the discipline itself. Health informatics is that confluence of health information, health technology, healthcare data, and healthcare leadership. It all comes together in health informatics. So it's a wonderful program. Again, it's built by industry. It's evaluated by industry on a regular basis, and it's delivered from experts in all three of those colleges.
That's fascinating. Like, it's incredible to hear how it all began and how your vision turned into a program that continues to grow each year. Speaking of beginnings and opportunities, that naturally brings me to something many students often wonder about: careers in health informatics.
Mhm.
For students graduating from our program, what kinds of roles or job titles should they look for as entry points into health informatics?
Right. That's a great question. I get asked that question quite a bit. So I respond by saying two things. Let's first talk about the overall demand for health informaticists within our country today. So the US Bureau of Labor Statistics projects a 16% growth in employment in this field. So health information technologists, data analysts, medical registrars. Between 2022 and 2032, a 16% growth. And that's pretty sizable. And actually, Agrani, it's faster than the average for all occupations listed in the Bureau of Labor Statistics. And really, the surge is driven by digital transformation. You hear every day about transformation in healthcare, AI, how AI is changing literally everything. And that is driving the surge for students and graduates in this field. People who love care, some clinical backgrounds, some not with clinical backgrounds, who also like technology to move in this industry. So that's the demand. I also want to highlight the salary levels. So our program and health informatics programs in general are considered STEM programs. So a STEM program in the United States, typically your engineering, IT, those types of disciplines command a little bit higher salary in general. Not always, but in general. And in 2024, according to my sources, the median salary for health informatics specialists, the median, not the average, but the median salary was $103,000, with the top 10% earning more than $166,000 annually. Now, keep in mind that doesn't disclose how many years of experience these informatics specialists have. So keep that in mind. Just because that's the median salary doesn't mean that's what you're going to make coming out of a program like ours or any graduate program in health informatics, but the potential is there. And so not only can you work in healthcare, an industry that is really helping mankind, humankind, but you're also able to get a STEM degree and your long-term earnings potential is there. So that is the demand, the salary levels for roles in this industry. As far as the types of jobs that you can get, there's a wide variety. So I tell students that if you love data analytics, you could go into data science. You can specialize in data science through our program. You can take electives around data analytics and data science and big data and AI. And you can get a job as a graduate of our program doing health data analytics. You can be an analyst in a Department of Medical Records, electronic health record, anything working with healthcare data, health insurance, revenue cycle. Several of our students are looking into the revenue cycle space, working with billing and coding data, for example. You can also look at implementation. So implementation of the electronic health record, um, implementation of a new electronic health record, or working for a department, let's say in a hospital, where you do ongoing upgrades of your current EHR. You can get into health IT project management if you have a clinical background like nursing or PT, or we have several physicians who are in our program. They can get into clinical informatics or medical informatics. So those are just examples of like a starting point, get entry level positions. From there, with experience and some leadership development, which we also offer at the university, students can one day become chief information officers, chief informatics officers, chief technology officers, roles such as that. So the sky's the limit in this industry, which makes it so incredibly exciting.
That's a great point. And I'm sure many of our peers often ask the same question: what roles can we really aim for after graduation?
Mm-hmm. Mm-hmm.
And it's reassuring to know that there's such diversity in opportunities within the field.
Mm-hmm. Yeah, very much diversity for sure.
Yeah. Now, beyond job titles, let's talk about something that connects us all: the
Mm-hmm.
impact.
Right.
Can you share a story where health informatics made a real difference in patient care or outcomes? that inspired you personally?
Yeah, absolutely. That's a really good question, Agrani. Having worked in healthcare for 30 years, I was able, fortunately, to be at a level in the organization where I sat on several different committees. And one of the committees I sat on was a committee where we reviewed potential, sentinel events or errors. So our risk management staff would give us a report every few weeks, or I think it was maybe even every week, of system potential or actual system errors, an error in the process that could have produced harm in some way. And I'll never forget one of the examples or one of the near misses that we had in my organization, and that had to do with a nurse in the hospital working at the bedside. So, those of you listening to this podcast, or Agrani, if you've ever been in the hospital, I know that I have. You have a wristband, right? That's how they identify who you are. And the wristband, when you're in a hospital bed, the nurse comes in and looks at the orders. And in this example, the nurse had an order to give the patient a medication. And so the nurse scans the patient's wristband. Then the nurse, per the order, pulls the medication and scans the medication. And right before delivery of the medication, the system gave a very impactful alert saying, stop right there. Something to the effect of stop right there. You don't want to give this medication. There could be serious adverse effects of this medication because of other medications that this patient was on. In healthcare as providers, it is hard to keep track of all the different medications and which medications combined can deliver an adverse effect. And so I don't want to say this is frequent, but there is a need that we need these checks and balances at the bedside. And in this case, um, this nurse was alarmed and she was stopped before potentially inducing harm to a patient that she wasn't even aware could happen. So if you think about what health informatics did in this instance, first of all, it prevented a catastrophic medication error. I mean, directly saving a patient's life. So that's first and foremost. That system, because of the data in the system, because the technology and the user experience, the nurse's ability to fluently use that technology, this prevented a catastrophic error. So that's number one. The second thing is think how that technology and health informatics really enhanced communication and coordination between the nurse, the pharmacy, and then the physician who ordered it. Really, stimulated conversation that then would ensure seamless care. When that happens, then it's also a learning opportunity. So the nurse learned, oh, this medication with these other medications is not a good option. The physician learned that as well. The pharmacist may have learned, oh, we have to communicate a little bit better about that one medication and the adverse side effects in certain types of patients. Providing real-time decision support right there on the spot. That is one of the best way for people to learn is in the moment, right? If you think about how we as human beings learn, the textbook is great, the professor's lectures are great, but in the moment really impresses learning on human beings. So it really, really helped with that and, improved patient safety. And if you think about hospitals and having to report patient safety scores and things like that, it was just, a wonderful opportunity to save a patient and keep our quality and safety where it should be in a hospital. So there are so many reasons why this particular example is so powerful, because the permutations of how it helped the nurse, well, first the patient, then the nurse, the pharmacist, the clinician, the physician who ordered the medication, and then the systemic impact of that situation and that technology is just a powerful example. And Agrani, I could name several examples like this, not necessarily related to barcode scanning at the bedside, but other examples as well, which is why this industry is so powerful, why the people who are moving into the health informatics space are so important to the delivery of care to our patients today. So thank you for asking that question.
That's really like it's inspiring. And I can see how it connects directly, to what we learn in the classroom and how
Mhm.
technology, when used thoughtfully, can transform patient care. And that story really highlights the human side of informatics. And
Mhm.
for students listening today who feel inspired by that story, the next question becomes, what certifications, skills, or experiences can help students not only grow in this field, but also increase their earning potential over time?
All right. So I will start with certifications first, because I've already mentioned health informatics, the program itself. I strongly recommend, if you can't get a master's degree in health informatics, we have certifications in health informatics. So if you're a nurse and want to move more into the technology space, if you're unable to do a master's degree, and most of them today are delivered online, or in person. Many of us have those options as well, but very flexible learning. Our programs are anywhere from 12 to 18 months if you go full time. So that provides that opportunity for people already working clinically. I am a strong proponent of then certifications beyond the degree. So there are organizations, the Health Information Management Systems Society, also called HIMSS, is a huge organization that most people who work in healthcare technology are a member of. And so I encourage you, if you're listening to this podcast, if you're working in this space, if you're not a member of HIMSS today, become a member. If you are a student in our program at UNF, or any master's or certification or undergrad program, you can become a student member of HIMSS. There are a lot of learning opportunities through HIMSS. There's an annual conference. They have webinars. They also have a certification that you can get entry level, that just with a degree, a bachelor's or a master's degree and some experience, and that even could be a project that you work on, they have an entry level certification. So that is one group. The next group that I think about for certifications are, if you're a nurse, if you are a trained nurse, uh, board certified nurse with, I think it's 2 to 3 years of experience. The American Nurses Credentialing Center provides a nursing informatics certification. And then if you want a more, as you work in the field, and also if you have a clinical background, the American Medical Informatics Association, also called AMIA, provides an advanced certification as well. So anybody with a clinical background, primarily a physician trained background, would qualify for an AMIA certification. So I'm a strong proponent of certifications in any field, actually. I'm board certified in healthcare management, for example, but I'm a strong proponent because it really levels the playing field for everyone in that field and shows a certain level of knowledge that you as an individual possess. And in healthcare, pretty much, well, not pretty much, many people are board certified. So your physicians, your nurses, your physical therapists, your laboratory scientists, laboratory technologists, they're all board certified. So why wouldn't you be board certified in informatics? And so I strongly encourage that. Get your degree. If you can't get a master's degree in health informatics, get us some type of certification from a university in that field, and then go to a professional society like HIMSS, ANCC, uh, AMIA, uh, the Health Information Management Association, AHIMA, American Health Information Association, AHIMA also provides some of those certifications as well. Get certified and then get started. That is the best way to get going in this career. Then the other thing I would say, Agrani, is we should all be lifelong learners, right? So once you're in, um, you always should be looking at ways to develop yourself, develop your leadership skills if you want to move into leadership, develop your analytics skills, develop whatever skills that you need in order to do your job. That should always be on your mind as you're moving throughout your career.
That's really practical advice. Students will definitely appreciate those insights.
Mhm,
And it's also encouraging to see how intentional skill building during learning can make a big difference later.
mhm,
You have mentored so many of us throughout this journey, which brings me to a more personal reflection.
mhm.
Looking back, what has been the most rewarding part of building this program and mentoring students like us at UNF?
Oh gosh, I don't know how much time you have. This is a big question because I could say, so many things. I think what I would say, there's two things if I had to narrow it down. The first thing is I love seeing students light up. You're one of them, Agrani. You light up when we talk about health informatics and the potential that's there. The technology is not going away. It's part of our life. You hear every day about AI on the news. That's part of healthcare as well. And really knowing that this is a wonderful industry to get into. Many of us chose not to be clinicians for many reasons. Some of us in this program have chose to be clinicians. Either way, finding this field and seeing my students light up about the the content that they're learning in the classroom, the projects that they're doing, the leadership that they're developing through the clubs such as the Health Informatics and Analytics Club, that is really rewarding to me. So that is one of the things. We are a fairly new program, so we've only had a handful of graduates at this point, but the graduates that we have had have been able to find pretty good jobs. And that is the second thing that I think is most rewarding is that our students are well prepared. They come back to us and say, I got what I needed from this program. Number one, I feel very confident in my ability. And number two, I got a job in this field. And, it's great to go to school, but you want to do something with it. And our students are finding jobs. And so I'm really excited about that. I'm excited that the content is accurate, that it's based on and built with industry experts. And number two, that our students are competitive in the marketplace and that they're getting jobs. So those are the most rewarding aspects for me.
That's such a meaningful perspective. It really shows the heart and purpose behind the program you have built. And it's amazing how those values continue to shape every class and every student that comes through.
Great. Thank you.
Yeah. So now, before we wrap up, let's switch gears and have a little fun.
I like fun.
Yeah. So we will end on a lighter note, a quick rapid fire round.
Okay.
Just say the first thing that comes to mind. Morning person or night owl?
Oh, definitely night owl.
Okay.
Definitely night owl. You don't notice that, Agrani, when you're getting emails from me at 12:30 at night, 1
Yeah,
o'clock?
that's really cool. So, one book, podcast, or movie you did recommend to students right now?
Hmm. Um, in the health informatics field, definitely, there is a podcast. It's called For Your Informatics or FYI, For Your Informatics podcast. It is sponsored by the American Medical Informatics Association. I mentioned them earlier, AMIA. And what I love about that podcast is that it showcases individuals at all stages of their informatics careers, some of their backgrounds. It showcases some of the issues that they face. Definitely is something I would recommend for students right now.
Okay, that's really great. One tech tool you can't live without.
Oh, Google.
Oh,
Google.
that's really, yeah.
I know that's like so basic, but you got to remember I'm much older than you are, Granny. I remember when Google came out, when the World Wide Web came out, and I said, "The what?" And now all that information is at our fingertips. It's a
Yeah,
beautiful thing. I don't think I could live without Google.
yeah. Favorite place on UNF campus?
Well, definitely the courtyard in front of the Brooks College of Health. So, for those who haven't been on that part of campus, there's a beautiful flower garden right in a fountain area.
Yeah, that's
Uh,
really beautiful. Yeah.
Really beautiful with hammocks and things. And the hammocks are always full, so I can't ever lay in a hammock because our students uh, definitely love relaxing there in between their classes. But definitely one of my favorite places on campus.
One word to describe the future of health informatics.
Explosive.
That it is
Explosive.
really, yeah, it's really explosive.
Hmm.
So that was a fun round. Thank you for playing along. It adds
Yes,
such a personal touch to the episode.
yes, absolutely. Happy to share.
Yeah. And Professor Thiemann, thank you so much for sharing your story, your vision, and your advice with us today. Before we close, is there any final thought or message you would like to leave for students who are just starting out in health informatics?
I think my final message would be, focus on your studies. Definitely focus on your studies. Get all that you can out of your educational experience. Reach out to your professors, get to know them. And then at least by the second to the last semester, start reaching out to industry and working on projects, getting involved in HIMSS, local chapters, national, etc., and getting involved in the industry. That would be my advice.
That's such an inspiring note to end on. To our listeners, thank you for tuning into the HIAC One-on-One Podcast. We'd love to hear your thoughts. What inspired you most from today's conversation? Share your reflections with us through HIAC's channels and let's keep the discussion going. Until next time, I'm Agrani Sinha and we look forward to having you join us again soon.